This is my St. Thomas University ID card, Susan Stites. Hi there.
Hi.
Hi, my name's Susan. I'm a psych nurse practitioner student with St. Thomas University, and I'm going to be doing this intake psychiatric appointment for Mia. And is your name Christopher Stites?
Yes.
Okay, and that's your daughter Mia?
Yes.
Hi, Mia. My name's Susan. So it looks like Mia's got a little bit of an entertainment device there while we just talk about a few things.
Yep.
Okay. All right, Mia, how are you doing today? Does she get a little scared if it's somebody new?
Yeah.
Okay. All right. Well, Christopher, I'm going to basically be doing this interview with you, and we're going to go through a lot of questions here so we can get the history and make sure we can get Mia the help that she needs. And so I saw on your intake paperwork that you had said that your 2-year-old daughter has a big problem with separation anxiety. If she hears you say that you're going to go out of the room, she starts crying and acting scared and upset. And if she sees you go upstairs, without her, she has an emotional breakdown and she cries really hard. So that's what I was reading that you had said on your intake paperwork. I'm going to ask you some questions specifically about when it occurs, where it occurs, and that information. And so, how long has this been going on for that Mia's been very upset if you leave the room or if she doesn't see you? How long has that been going on for?
I guess over for a year now.
Okay.
Yeah.
And where is she doing this at?
It could be anywhere. It could be home. If I say I'm leaving, if she sees I'm leaving, if we try to check her in at a church service, she'll be screaming her head off the whole entire time.
Okay. And then when she's crying, how long is she crying for? Is there typically?
Like at the church service, it was basically we were told it was basically the whole time. She had to be held the whole time.
Okay.
Um, if at home, it'll be for at least a couple minutes, and then like if we give her something to be entertained, then like if we put on a show, she usually might stop after that, and then we
Okay.
can go do other stuff. But
Okay.
if yeah, if not given something, uh,
To
it
distract
could
her.
go on for a long time.
Okay. And then is there anything that makes it worse? Like you
Uh,
were saying, if you leave the room, that makes it worse, or if you go upstairs,
yeah,
that makes it worse.
yeah.
Okay. And what makes it better when she knows that you're there?
If, not just if she knows that I'm there, but like if I'm back with her and like holding her again.
Okay, then she's satisfied. Okay. And then it does it happen any time that you leave, or is it just during the day or at night?
Uh, Mostly during the day. It can be sometimes at night.
Okay. And then what severity would you say this is? Would you say it's very severe or just kind of mild?
I would say it's severe.
Okay. So I'm going to ask you some questions specific for Mia and how she's doing. So does she currently have any fever, chills, change in her eating habits, or any change in her weight?
No,
Okay. Does she have any wheezing, coughing, shortness of air, or any difficulty breathing?
no,
Okay. Any history of any heart disease like murmur, swelling, blueness in her hands, feet, or mouth?
no,
Okay. Any change in her pattern of speech?
no,
Any history of seizures?
no,
Any noted developmental delays?
no.
Okay. I saw that you had written down on the intake paperwork that she's followed by the Nemours NICU Developmental Clinic because she had time when she was in the NICU. Does she still follow with them?
Yeah.
Why was she in the NICU?
Her biological mother was doing drugs while pregnant with her, so she had to be weaned off that.
Okay. Okay. Eh, do you guys have her? Is she a relative or why do you guys?
We've adopted her now.
Oh, okay. Was she in the foster system?
Yeah, she was in the foster system.
Oh, okay. Gotcha. And then how old was she when she came to you all?
She was a couple hours old.
Okay. Okay. So after her time she was in the NICU, then she left and went to you guys?
Oh, yeah, yes.
Okay. Okay. What type of activity does Mia do? What kind of exercise or activity does she do normally do?
We have a playground, and she likes to climb on that and slide down, do the swing, and also sometimes go on a walk to see. Some neighbors have horses, so walk
Mia, do
around.
you like horses? You like horses, Mia?
Yeah, she does.
Okay. Is there any change in how she's walking?
No,
Okay. Any swelling in her arms, legs, or joints that you've noticed?
no,
When she is with you, does she seem to be clingy?
yeah,
Okay. But is she happy when she's with you most of the time? I mean, she looks happy right now.
yeah.
She's content and quiet. As far as nutrition goes, is she a picky eater or does she eat pretty much anything?
She's pretty picky.
Okay. How many meals a day does she eat?
Three, we feed her three.
Okay. And then what does she drink during the day? Does she drink water, milk, juice?
Water and milk.
Okay. But you feel like she gets does an adequate amount of pee diapers and bowel movements?
Yeah.
Okay. And then what is her sleep rest pattern like? Does she sleep through the night?
Yes, usually. Yeah.
Okay. I saw in your paperwork you said that she does wake up still some. Are you able to get her to go back to sleep?
Yeah.
Okay. Does she take a nap during the day?
Yes.
How many naps does she take?
One nap a day.
Okay. Um, and so on that paperwork from the NICU developmental clinic that the Nemours Hospital that you said she has to go to sometimes, are they saying that she's been meeting all of her developmental milestones?
Yes, she has.
Okay, that's good. Okay, does she have any known allergies to any medications like food, or any medications, latex, environmental, herbal, any allergies that you know of?
No.
Okay. Does she have any diagnosed psychiatric history?
No.
Okay. Any hospitalizations for Mia other than her initial hospitalization after delivery?
No.
Okay. Any outpatient psychiatric treatment for Mia previously?
No.
Okay. Does she have any other medical history besides being a substance exposed baby?
No.
Okay. Any prior surgery for Mia?
No.
Is she taking any type of medication right now, like a prescription medication, over the counter, herbal, or psychotropic medication?
No.
Okay. Is she exposed to any illicit substances now?
No.
Okay. Does anyone around her drink alcohol or use any cigarettes?
No.
Okay. Um, so let's see here. I know this is a lot of questions, so hang in there with me. Do you know what her family psych history is? Like her biological mother or father?
Not psych history, no.
Okay, you all do not know that. Okay. Who does she live with currently?
Um, my family, me, my wife, and children.
Okay. How many other children do you have?
Seven.
You have seven. Oh, wow. I
Yeah.
bet have you adopted some of those? You look kind of young to have seven.
Yep.
Oh, okay. Wow. That's great. That's a great ministry. Does she go to preschool or daycare?
No.
Okay. And then where was she born? Was she born here in Florida?
Yes.
Okay. Do you know what county was she born in? I thought it said Osceola on the
Yeah.
paperwork. Okay, okay. Any trauma history after she was born?
No.
How long has she been with you guys? It was after she got out of the NICU and she came straight to you all?
Yeah.
Okay. All right. Has she ever been exposed to any violence
No.
once she came to you guys? Okay. Any prior screenings like at the dentist?
Dentist, yeah.
Oh, she's been to the dentist? Okay, good. And then are her immunizations up to date?
Yeah.
Okay, so I have a questionnaire that I'm going to ask you that just has some specific questions um, about about her and her separation anxiety. So you would just tell me, is this true frequently or not true very often or not true at all? When she feels frightened, it's hard for her to breathe.
True. Yeah.
Okay. She doesn't like to be with people that she doesn't know well.
True. Yes.
Okay. She follows me wherever I go.
True.
Okay. Does she feel, my child feels nervous with people she doesn't know well.
True.
Okay. My child worries about sleeping alone.
True.
Okay. Um, when my child gets frightened, her heart beats fast.
True.
Okay. When she is scared or frightened, she gets shaky.
True.
Okay. Um, when my child gets frightened, they sweat. She sweats a lot.
True.
Okay. She gets really frightened for no reason at all.
True.
Okay. My child doesn't like to be away from her family.
True.
My child feels shy with people she does not know.
True.
My child is afraid to go places without me.
True.
And my child is shy.
True.
Okay. All right. So you answered yes to all of those. Let me calculate that score here real quick. Okay. Based on this screening tool, she does qualify for disorder, for separation anxiety disorder. Okay. So currently at her age, there is no medication that's recommended for that. But what is recommended is a type of therapy called cognitive behavioral therapy. And they also incorporate play therapy for separation anxiety disorder in a toddler, which she is a toddler. She's 2.5. And this, just to let you know, this type of therapy will help her to manage her anxiety at an age appropriate level. And it also incorporates exposure therapy so that she's regularly during the therapy exposed to this separation and that she can see that you return. So it helps her to know that you are coming back. So we would like to help you set that therapy appointment up. We would make that referral for you for the cognitive behavioral therapy. And that has been studied to show that it is beneficial for children as they grow and develop to reduce the emotions and feelings of separation anxiety disorder. Okay. So would you like for us to set that therapy up for you and for Mia?
Yes.
Okay, I really recommend that. You would definitely, since you're the one that you said that she seems to have this extreme difficulty with separating from, you would want to make sure you were there for the therapy appointments because they are going to do that exposure therapy, and you would be you're the main caregiver and the one who is with her the most and the one she feels that separation anxiety from. So we recommend that you would be there for that treatment for her. You would follow the protocol that the therapist has on the frequency and the duration of the visits, and then you would follow up with us for an initial follow-up in about 4 to 6 weeks so we can review Mia's progress. Okay. And that would be 4 to 6 weeks from the time of her first visit. So we would like to offer you a few strategies to promote and develop skills to help Mia manage the separation anxiety before you all start your therapy and as she continues the therapy. And the first thing we want to recommend is that you expose her to opportunities to experience this separation from you so it becomes easier for her to deal with, especially before she starts school, because you mentioned she doesn't go to preschool or daycare. We also want to recommend that you give her consistent, clear communication that is easy for her to understand, especially when you are leaving, that daddy's leaving, but I will return. When you do have to leave, we want to recommend that you say goodbye quickly and then go ahead and leave. Okay. We don't want to drag it out and give her the opportunity for an extended crying period in your presence. Okay. So you just want to quickly say goodbye and then go ahead and go where you need to go. And then she'll see that you return. Now, we also have a few things we want to recommend that are self-management methods on how to incorporate healthy behavior that Mia can incorporate. So Mia, we want to recommend that you talk to her and that you tell her that it's okay for her to have different emotions. And she'll understand that more and more as she gets older, that it's okay for her to have these emotions and that you're there, you support her. The next thing is to model appropriate behavior for her, which will show her how to have control over her own emotions. So you're not crying, you're not upset when you're leaving. You're just simply having controlled emotions, telling her goodbye, giving her a kiss, and that you will return. And then the last thing we want to recommend is that you teach her self-soothing by giving her something that's comforting to her, like an object that brings comfort, such as her one of her favorite stuffed animals or her a cozy blanket that she has, just to give her an extra opportunity for self-soothing as you're transitioning out of the space that she's in. So, based on this information and the interview that we've done today, do you have any questions for me, Christopher?
No.
Okay. I'm thinking Mia probably does not have any questions for me. So, but if you come up with anything, hi Mia, if you come up with anything or any type of question between now and our follow-up, you can feel free to go on our patient portal or give us a call and let us know what that question is. We're happy to help. And when you check out today, we're happy to get you set up with that referral for that cognitive behavioral therapy and play therapy for Mia, so we can get this process started and help Mia to get better. So we appreciate your time, and it's very nice to meet you and Mia. And I wish you the best, and we'll look forward to see you again at your follow-up appointment.
Thanks.
Okay, thank you, Christopher. Thank you, Mia. Have a good day. Bye.
Bye-bye.
Bye-bye.